Hi everybody. So in this video we're going to finish up Module 65, which is what we started in class today on abnormal psychology. And you can see we've talked about the 4Ds. Fifth period we got a little bit into the history of how they used to treat people with disorders with chephning, torture, lobotomies. We'll look at hospitals today. First period we'll talk about this in class tomorrow. So don't worry about that. Then we'll take a look at labeling, and then we'll get into causes and treatments tomorrow in class. So that's kind of where we're going for this module. If you need a concept map model, this would be a good one for Module 65. So the 1800s were a very important time period because at that point in time, medical professionals started seeing people with mental disorders as having an actual sickness rather than being completely crazy or being filled with evil spirits. And so when someone's sick, where do we send them? We send them to a hospital. And so they started to form psychiatric wards of hospitals and complete hospitals in and of themselves that would just take patients that were considered mentally disordered. And you would think that, okay, if they're in the hospital, they're getting better treatment, but that actually wasn't the case. These hospitals were barbaric and horrible. They actually charged admission. They charged admission for people to come in and see the crazies. They were chained to the walls. I mean, they were not fed properly. They were walking in their own urine and feces a lot. So it was really just a place where the mentally ill could go and be out of society's way, and people even profit off of it. So just because they were in hospitals did not mean that they had better treatment. This is a picture actually of one of the treatments they used to do in psychiatric hospitals. They would just wrap the patients in cold, wet bed sheets and cover their heads with cold, wet cloths. And they thought that this might cure them of their disorder. So kind of shows you our lack of ignorance, or our ignorance about all these treatments. I don't know if you can see these on the video, but these are reasons for admission to a psychiatric hospital, 1864 to 1889. And you can pause the video here and kind of look at all of the different things that you could do in order to wind up in a psychiatric hospital. Some of them are pretty crazy and interesting. I don't know what my favorite is. I was kind of looking through and seeing, but you can read them and see. I'll show you in class tomorrow too if you're having trouble seeing the video. But someone that you need to remember is Philippe Pinel. He was a French doctor who was the first person to really advocate for better treatment for the mentally ill. He did not see them as something to be profited off of. He saw them as people and wanted them to have better conditions to live in and to be treated in. And so I've seen him on the AP test before, just as someone who's advocated for the mentally ill. He'd actually go into these psychiatric hospitals and hold dances or balls for the people so that they would be able to socialize and get to meet the other patients that were there rather than being locked in a room all day. Dorothy Dix was the first United States woman to advocate for the humane treatment of mentally ill. So her and Philippe are probably the two most important people you want to know when we're talking about people that are lobbying for better treatment. She also did a lot of other important things with the poor, but for psychology, she's well known for helping out people with mental disorders. Okay, so probably the most important thing out of this module that you must remember, that will probably be on the test, is the DSM-5. The DSM stands for the Diagnostic and Statistical Manual of Disorders. So this book is the big Bible, if you will, of psychological disorders. You can find every disorder in there. This is what any clinically based psychologist uses to diagnose their patients. It's important to know that the DSM classifies disorders and describes their symptoms, but it does not explain the causes or cures for disorders. And that makes sense because remember we talked about all those different perspectives of psychology you could have. You could be a psychoanalytic psychologist, a biological psychologist, a humanistic, a cognitive psychologist. So whatever your viewpoint of psychology is, that's how you're going to determine what the cause of the disorder was or how you treat the disorder. You know, a Freudian psychologist is going to say someone has a disorder for a very different reason than a biological psychologist will. And they're going to treat those disorders very differently as well. So this book does not talk about either of those things. It just lists symptoms. And so this book is actually very reliable because it's not subjective. You can go to any different psychologist and you should be able to get the same diagnosis from each one if you have a disorder because they just check off the symptoms off of the list. And as you can see here on the screen, there have been several revisions of the DSM. We're on the 5th version. And you can see with each one, it's getting bigger and bigger, which is what we kind of talked about in class a little bit today. Here's another graphic that shows you how much the disorders are growing over and over. And this doesn't even have the 5th version on it. I think 16 to 20 new disorders with this 5th version. So here are some of the new disorders of the DSM-5. Hypersexual disorder is a new one. We also have premenstrual dysphoric disorder. So this is like PMS on steroids, basically. Then we also have binge eating disorder. So this would be people that don't purge. So it's not like bulimia where they eat and then they throw up. They just binge all the time. So if you pig out a lot, that would more than like 3 times a month, I think is what it is. Or at least once a week for 3 months, you get this disorder. Post-traumatic stress disorder in preschool children. So you used to not be able to diagnose PTSD unless a person was a certain age, but now we can diagnose it in preschool children. Another new one is learning disorder. So any of you guys that know anybody that's in special education or has what we call an IEP, which means they get special services for school, that used to not be classified under the DSM-5. That was a different type of disorder. But now learning disorders are psychological disorders. So if you have issues in math or you can't read very well because of a disorder, now it's a psychological one. Then we also have cannabis withdrawal. That's a new one. Great for all of our Colorado friends and Washington State friends, I guess. And then the last new one, hoarding disorder. So if you've ever seen Ultimate Hoarders on TLC, these people are now classified as having a disorder. One last interesting criticism of the DSM-5 is that there were a lot of pharmaceutical companies that participated in the rewriting of all the material. And so a lot of people thought that the pharmaceutical companies were intentionally trying to broaden the span of all of the disorders so that they could get more of their drugs in people's hands and therefore make more of a profit off of it. So psychologists right now are kind of split on whether they like it or not, but they don't really have a choice. They have to use it in their practices if they want to be certified. So we'll see what happens. This is one last interesting chart I wanted to show you regarding the amount of mental disorders that exist in the world. So you can see that the United States reports the most out of any major country. And this doesn't necessarily mean that we have more people that have mental disorders. It could mean that we're just diagnosing more. But I think it's an interesting statistic to look at. The last major thing we need to talk about in this video is David Rosenhan and the power of labeling with psychological disorders. So this psychologist did a famous experiment where he had 8 volunteers go into mental hospitals saying that they were hearing the sound and word thud in their head, T-H-U-D. And they were just saying they kept hearing these voices and hearing the sound. And so they were all diagnosed with schizophrenia in these mental hospitals, and then they were put in for treatment. Problem is, they really didn't have schizophrenia, and so what they did is intentionally after 3 days, they stopped reporting those symptoms, and they just, started acting normal again. And they were not let out of the psychological institution. The nurses started to interpret, because of their label of schizophrenia, the nurses started to interpret all of their behaviors as being symptoms of schizophrenia, even though they weren't necessarily symptoms of schizophrenia. They were using that label to interpret everything underneath. So another good example of that is this baseball team here. This is a real baseball team that used to compete back in the day, and they were actually the workers at the asylum, but nobody wanted to play them because of the stigma of the asylum on their shirts, even though they weren't actually mentally ill. Another really interesting story is I remember hearing about a guy who in Great Britain committed a crime. He was supposed to serve 1 or 2 years in jail, but he didn't want to, so he decided to fake mental illness to get out of his prison sentence and hopefully be sent to a cushy hospital instead for the year or 2. Well, he fakes it really well, and they believe him, and then he gets to the mental hospital, realizes that it's not cushy, it's not good at all. He hates it and wants to get out, and so immediately he changes his mind and is like, all right, guys, I lied. I'm really not mentally insane. I just played the part so that I could get into this mental hospital. But they said, no, faking mental illness is a sign of mental illness. So what was supposed to be a 1 to 2 year prison sentence ended up being 12 years at a hospital, a psychiatric hospital in Great Britain. And he wasn't able to get out because they thought that he was a sociopath, that he had antisocial personality disorder and was manipulating them. So it's very interesting how labels can kind of play a part in disorders. This was an event a couple of years ago. I don't know if you remember, there was a French, I think, pilot who it was a suicide mission. Basically, he crashed the passenger plane that he was carrying, locked the other pilot out of the cockpit. But basically, these are the headlines that happened. And so David Rosenhan basically says, no wonder nobody wants to report their mental illness because there's such a stigma. People look at people that are labeled as mentally ill as being these I don't know, untouchables. But really, I think if you think about it, more of us suffer from mental illnesses than you really think. We saw in our true and false that it's 1 in 7 people. So it's really important to be careful about labeling with this. But on the other side, some people say labeling is good because in the courtroom, for example, like you have to be able to tell if someone was mentally sane or not when they committed a crime. And so psychologists, especially forensic psychologists, their main job is to see, was this person in the right mindset when they committed this crime, or were they totally unaware of what they were doing? Because in order to help someone and give them the correct sentence, you need to know. So some psychologists really like the labeling, and they think that it can be helpful. This is just an example of recent cases. The guy on the bottom is the guy who shot up the movie theater in Colorado for the Batman premiere a couple years ago. I believe he was labeled as criminally insane, so he will not suffer the same sentence as someone would if they were sane. The guy at the top is from Chardon, Ohio, up near Cleveland. He shot up a school, killed a couple people, and one of them was actually my college roommate's cousin. But anyway, he walked into a courtroom with a nice blue button-down vest, and as he got in there, he undid the buttons, and he was wearing this white shirt that said killer on it, and so he was trying to claim that he was criminally insane at the time, but they ruled that he was sane and he couldn't get out of his sentence. Last two disclaimers, super quick. This is an article from The Onion, which you know is a satire newspaper, but it says freshman psych student diagnoses roommate with bipolar disorder. So a lot of times when people take an introductory to psychology course or in college or in high school, they think that, okay, now that I know about all these disorders, I can go ahead and like start diagnosing people with it. But you can't. So I can't even do that because I'm definitely not a psychologist. So just make sure you use caution with that as you start to interact with people and don't go around diagnosing them with all these disorders. And then the last disclaimer is just be really cognizant of how you talk about these disorders in class, because you never know when someone's actually suffering through one of these disorders, especially some of the ones that can remain hidden. And so saying like, oh, I feel so depressed today, or oh, she's so bipolar, or wow, you look so anorexic, like can really upset some people. So just make sure you're being tactful and treating this unit like you would as a true psychologist, because that's what you guys all are going to be, right? So thank you for watching, and I will see you guys all tomorrow.